Welcome back to ISF. This week is Eating Disorder Awareness Week, and we had the incredible opportunity to learn a little more about eating disorders and who it affects.
That's true. That's true. It was a really good interview. And did you know that eating disorders don't only affect women, but it does men as well? Dr. Wendy Oliver-Pyatt of Galen Hope stopped by to kind of break everything down for us. In honor of Eating Disorder Awareness Week, we're actually speaking with an expert today on all of the things. CEO of Galen Hope, Dr. Wendy Oliver-Pyatt, here to break everything down. So welcome to the show.
Well, thank you so much for having me. I really appreciate being here. It's such an important topic.
No problem. It is an important topic. When we're talking about eating disorders, what does that look like in someone?
Well, I think the first thing to know is that it doesn't look like any particular way in any one person. The eating disorders affect all genders, all ages, and all sizes, shapes, and bodies. So we have to get past the preconceived notion of just one race having an eating disorder or one age or eating disorders only being in thin folks, because men constitute 25% of people with eating disorders, and 40% of the people who have binge eating disorder are actually men. And it really is something people suffer greatly from, mind, body, and soul.
What exactly is it? How do we describe an eating disorder?
An eating disorder, there's multiple different kinds of eating disorders. They all are a little bit different, but the important thing to remember is that an eating disorder really zaps a person opportunity for joy and peace in their relationship with food. And eating disorders affect every organ system in the body and have the second highest morbidity and mortality of all mental health conditions, affecting every organ system. And one person tragically dies every 52 minutes due to the consequences of an eating disorder. They're complex, serious mental illnesses that affect the relationship with food, oftentimes the relationship with self-worth and body image, and just a person's ability to appropriately nourish themselves. And that can be a person in any size of body. We must never assume that based on body size, the person may or may not have a terrible eating disorder.
Could be anyone out there.
Could be anyone, absolutely.
Now, Dr. Wendy, you went over what the serious consequences. You went over that it can impact anyone. Let's talk about treatment.
Yes.
So Galen Hope is a safe haven for people to come and get treatment. What does that early treatment look like, and why is it key?
It is so key because early intervention really can block the terrible consequences of an eating disorder, medical and psychological. And so at Galen Hope, we really offer a very humanistic, very warm environment that provides like very comprehensive, sophisticated psychological treatment. Folks that come to Galen Hope feel very welcomed and really form a connection with one another and a connection with our team, which includes psychiatrists, dietitians, psychotherapists, what we call care partners, a multitude of different groups. We have internal medicine doctors and nurses, and we just can wrap the person around the love and care of the team and the expertise of a multidisciplinary team.
How can we contact you guys? You guys have 2 locations, so break all of that down.
Yes. Well, thank you for asking. I think that it's so important to know that help is there, and stigma oftentimes get in the way of help. And so we have to kind of work through that, especially men can have a really hard time overcoming the stigma. We work with all genders. The way to get help is to call us. Go to our website, which is www.galenhope.com. Our team member will be there to provide support, and we can provide assessments. And then if you don't need the level of care that we provide, which is a very comprehensive care, we can also refer folks out to some of our community partners. Effective treatment is available, and people deserve it. People deserve to have a peaceful relationship with food, their body, and health and joy in that relationship.
Dr. Wendy, thank you so much for coming.
Thank you for having me.